This is The Corner Series, a McGuireWoods series exploring business and legal issues prevalent in today's private equity industry. Tune in with McGuireWoods partner Geoff Cockrell as he and specialists share real-world insight to help enhance your knowledge.
Thank you for joining another episode of The Corner Series. I'm your host, Geoff Cockrell, partner at McGuireWoods. Here at the Corner Series, we try to bring together deal makers and thought leaders at the intersection of healthcare and private equity. I'm thrilled to be joined today by my good friend, Rebecca Springer. Rebecca spent a long time at PitchBook, where she was a research analyst and was really a pioneer in bringing a lot of analytical detail to the private equity investment in healthcare sector in general, and just had a lot of insight and market analytics, and was just a tremendous resource. And we've collaborated on a number of things over the years. Rebecca is now doing something different. And Rebecca, I'd love to have you kind of give a little bit of background on what you're doing at Bailey & Co. And then we can jump into some discussion.
Yeah, sounds great. Thank you so much for having me, Geoff. Really excited to be joining you today. I joined Bailey & Company about 2 months ago. Bailey is one of the leading independent healthcare investment banking boutiques. We cover healthcare services, healthcare IT, payer tech and services, a bit of pharma tech and services. And, you know, it's been an exciting journey so far over the last 2 months even. My role really focuses on thought leadership and business development for the firm. So we believe that by doing really sort of differentiated and deep research into areas that are of interest in healthcare broadly and to our clients and partners, we can be a real value add and create a differentiator for the firm. So that's what I've been working on, and it's been a great team to be a part of so far.
You and I think of development and thought leadership in kind of the same way. There's a lot of voices out there that kind of float over the top over broad areas of the market. It's a lot harder to dive narrowly and deeply, and we try to do that here and in other things that I do, and you've always kind of approached things similarly. To that end, it would be fun to discuss an area that I know you've spent a lot of time on, and that I think a lot of the investor community will be familiar with this, but a lot of the investor community will not be as familiar with kind of how we're grouping a number of kind of related segments. But maybe if you could describe the overall market segment of governance, risk, and compliance, and just how you group it and what's in those segments, and then we could talk about what some of the opportunities are.
Yeah, for sure. And to back up, we released a white paper a couple of weeks ago, just before JP Morgan, focused on the governance, risk, and compliance sector. This is an area where the team at Bailey has, around a dozen tombstones, has really assembled some of the leading platforms today through our work and has deep relationships. So that, coupled with some of the drivers in the industry and the interest that sponsors have been expressing in this space that we can get into, made it a good place to start in terms of our research efforts. So what is governance, risk, and compliance? GRC is a term that exists outside of healthcare, of course, and it's kind of been imported into healthcare to describe a collection of functions that you can knit together in different ways. But broadly speaking, we think of it in 4 buckets. So the first is provider data. Think of credentialing, licensure, privileging on both a payer and provider side, as well as provider directory and data management for payers. The second bucket would be workforce. So continuing education for licensure and certification goes into that bucket. The third is safety, quality, and risk. So think about patient safety, incident reporting, the efforts that go into trying to prevent incidents from happening in the first place, and then various quality measures, which feed into accreditation, stars ratings, and all that good stuff. And then there's sort of an other bucket as well that is going to encompass things like contract management, vendor management, identity and access, basically who gets to come into a facility and how do we ensure that they're properly credentialed to do so. So a big area with a lot of different dynamics, but one that we're pretty excited about.
I often think of GRC the same way I think of pharma services. Pharma services, we talk about it as if it's a sector. It's a sector in the sense that it's kind of all generally pointing at the same kind of customer group, mainly pharma companies, but the individual pieces within it are dramatically different and may not overlap in any meaningful way other than that kind of original premise. When you think of GRC, is it a structural paradigm to help bring together a bunch of not exactly related businesses, or are there some through lines that might enable, say, some consolidation within this arena to cross into your different buckets, or are they kind of distinct things?
Yeah, it's a great question. And it's one of the first questions that I brought to this space as a researcher. Why should all of the different pieces of GRC be put together in the first place? There are basically two theses in the market for why these things go together. And they're not mutually exclusive, but they are quite different. The first is a go-to-market thesis, and it centers on the role of the CIO within the health system. So isolating just the provider side for a second, we've seen over the last couple of years a real move for health systems as buyers of IT products away from lots of different shiny point solutions toward really consolidated buying power in the office of the CIO, preference for platforms where possible, and an aversion to implementing point solutions. Now, I will caveat that and say that in GRC, there are areas where sort of vertical point solution players are doing very well and taking market share even from some of the platforms. But in general, there's a thesis that if you can bundle these various different operational functions together and sell them through the CIO, there are cost savings to be had, there are efficiencies in terms of back office infrastructure at the company level, of course, and there's just an easier market motion. That's sort of thesis number one. Thesis number two is what happens when you knit all these pieces together in terms of your ability to derive insights and maybe even apply analytics and AI to some of the data sets that are generated when you're doing GRC. So one way to think about it is, if you take the EHR, we now have a system that touches every part of the patient journey, right? So you can, it's complicated, of course, but you can kind of knit together any data point along the patient journey and theoretically look at that as a whole and sort of, derive insights as a result. And we don't have the same technology right now for the provider or clinician life cycle. And there are a number of different things that have to happen along that life cycle that are often dealt with in complete silos. And if you can unify those pieces, then you can manage and develop your clinician population in a much more powerful way. So that is a vision that many of the platforms in GRC are pushing toward and are making progress toward as well.
How do you think the GRC arena maps over the ongoing kind of provider consolidation? So these are all largely businesses that are providing services to provider businesses. At the same time, the environment for those provider businesses is getting more complex, but also at the same time, there's consolidation. Do these businesses focus on the consolidating businesses, or are they efforts to make smaller businesses able to compete and navigate the complexities, or maybe a little bit of both? But how does this business map over kind of the ongoing consolidation in provider services?
Yeah, it's a good question. And I will say, there's a significant payer market here too that we can touch on. But the largest GRC market on the provider side is health systems. They have the greatest level of kind of regulatory and compliance and accreditation, complexity, medical malpractice, insurance, all that good stuff. This is a bigger problem for health systems than for a smaller independent provider. Now, there are platforms that have a lot of business in the ambulatory market, especially on the workforce side. If you think of the post-acute arena, nurses, PAs need to be credentialed and licensed as well. So you have players working with post-acute facilities and larger physician groups, but generally this is a health system focused market, and the level of consolidation in the health system world that we've seen over the past couple of decades has both increased the sophistication of buyers of GRC products and the need for more coordination at a centralized sort of enterprise level within the health system. So you can't do your credentialing at each individual hospital in a separate office, which is what used to happen in a lot of cases. You really need to be more coordinated about things. So it's been a tailwind for the industry is the short answer to your question.
On the assumption that in many of these businesses, the growth strategy at some level is going to be acquisition driven, whether that's kind of vertical acquisition or adjacent acquisition. How would you describe the current state of the GRC market? Is it very unconsolidated? Is it starting to consolidate? What does that look like?
So there's been a wave of consolidation, it's in the late 2010s, where a lot of the current platforms were put together. One thing that's important to kind of underline about GRC is that although there are some leading platforms, so you'd point to Simpler and HealthStream as kind of the two big ones out there, there is no sort of epic scale platform, right? There's no truly dominant player. There's no Cerner or Waystar or R1 for healthcare operations. So that remains to be seen who will, if any player will sort of take that place. So, it's an interesting point for GRC where there are incumbent platforms, there are challenger platforms. You would look at an RL that's gotten very big, Relias on the workforce side, MedTrainer, some of these other bigger players. There are scaled vertical players, say MD Staff or Propellus, that are growing very quickly. There are sort of smaller kind of sort of tech forward challengers that are also growing very quickly. So there's, when we speak to sponsors about the space, there's a lot of opportunity to do further M&A, I think, and to kind of come at this GRC space from a number of different angles.
As folks look at kind of businesses in this sector, what are some of the risks? You think of maybe how the challenges at Change Healthcare have reverberated through segments of this market. What are some of the front risks that these companies face?
Change has been interesting, had some various effects in general, sort of increased awareness around the need for good data and good compliance. In terms of challenges, I think the big one in this market has been integration, right? As mentioned, some of the larger platforms have been very acquisitive. This is a space where folks are knitting together what were historically very siloed point solutions and trying to find synergies in between them. And so just getting legacy systems onto the cloud and making sure that they really do talk to each other in a powerful way, and then trying to put the infrastructure in place that will allow sort of more powerful AI and analytics on top of various systems has been kind of the biggest project for platforms that are getting assembled in this place. And in some cases, kind of, there's still significant work to be done.
The challenges currently in provider services, or one of the challenges in provider services consolidation has been once you get to a certain size, trying to figure out who the ultimate buyer is. In this sector, who are some of the ultimate buyers? Is it financial? Is it big health systems, big payers? What do end buyers look like?
Yeah, I think it's a strategic buyer, and you could envision various combinations if you kind of zoom out to look at healthcare operations more broadly and then fit GRC into that. But at this point, none of the platforms are at such a size where you couldn't have a financial buyer either, or maybe look at an IPO exit. So fortunately, this is one of the reasons why this sort of like operational areas of healthcare IT are a lot more attractive to a lot of sponsors right now than say PPMs. There's a pretty wide range of potential buyers depending on what check size you come in at, even at the top end of the market.
And what is the kind of IPO market appetite for this sector been?
I mean, in terms of public players right now, you really have HealthStream only. Healthcare IT has not been the most in favor sector in public markets right now. But look, I think you have businesses that have attractive margins, are growing. It's a space that's probably growing at double digits overall, lower stroke of the pen risk. So I think this should be, we're not predicting any kind of imminent IPOs to be clear, but I think it's an area where you could look at public exits as an option.
Are all of these businesses principally technology businesses, or how many of them are people businesses?
GRC tends to be a software business. So you have workflow software as kind of the main component. On the provider data side, you do also need to do the actual work of credentialing. You have a CVO, a credentialing verification organization. That includes some manual work. It can be largely automated and streamlined by technology at this point, but there's always going to be a human element. So a lot of these businesses will combine a CVO, which is a sort of tech-enabled service and generates a lot of high-quality data with workflow and analytics technology around that data that can then extend into other areas of the payer or provider workflow.
So Rebecca, we've kind of explored kind of how these businesses are grouped together, some of the growth strategies and how people have gone about it. But we've not exactly addressed kind of why this sector, why now? Why is this a growing investment sector now?
Yeah, so I would say this, so name an area of healthcare IT that is growing pretty quickly, right? Probably double digits, doesn't have what I would call epic risk, doesn't have a dominant platform, does not have significant stroke of the pen risk, including with the sort of new administration, has material, partially realized or unrealized opportunities for technology innovation, and has a number of actionable assets at a variety of check sizes that will be actionable in the next 1 to 2 years. That's pretty hard to find. So I think that's kind of the short answer for why a lot of sponsors are interested in this space. And of course, healthcare IT in general has been a focus area for many firms as they've been kind of trying to diversify away from healthcare providers a little bit. In terms of the drivers of the industry specifically, have a number depending on what corner of GRC you're talking about. In general, the regulatory burden and the compliance burden on both providers and payers has increased over the past 10, 15 years and is only expected to increase, whether that's the number of entities that need to be credentialed, the number of data points per credentialing event that need to happen, the expected frequency of things like exclusion checks, and other sort of compliance monitoring checks, the cost of fed malpractice and liability insurance, the requirements from CMS and various accreditation bodies around patient safety and quality and reporting. The list goes on, but sort of all of those dynamics have been up and to the right in terms of the pressure that they're putting on health systems and payers. And provider directory accuracy and network adequacy is another area of increasing sort of regulation and pressure, particularly on payers. So all of these things have been drivers of increased investment in GRC. And it comes at a time when both health systems and payers are working to modernize their tech stacks, trying to move toward platforms that can unify different data sets, that could enable AI deployment, trying to get more efficient with the labor force that they have. So lots of tailwinds.
Lots of tailwinds. Thanks a ton for this walkthrough of GRC. I do think Bailey & Co. made a great move bringing you on board. I think your work in all these areas is pretty singular. So thanks for giving us the GRC walkthrough. While I have you, though, what other kind of trends are you watching? And I'm sure we'll see pieces from you on these, but what do you have your eye on?
We're pretty excited about 2025. We've certainly seen pitch activity pick up. We think a lot of great stuff is going to hit the market maybe around Q2 and have around 30 active mandates currently. In terms of research, there are a couple of areas that we are keeping a close eye on and will be publishing on soon. The first is ICHRA, so Individual Contribution Health Reimbursement Arrangements, one of my favorite acronyms to say right now. This is a small but fast-growing and disruptive corner of the employer-sponsored healthcare market that we're going to be digging into. Staffing models for skilled nursing facilities, another fun acronym, SNFists. SNFist groups, analogous to hospitalist groups, is an area that we've been having a lot of conversations around and think there are great opportunities in, and have seen some deal flow recently. We're looking at value-based care, an area that I've spent a lot of time in personally, and many of our MDs have as well, especially on the payer services side and payer tech-enabled services. We think there are significant opportunities there as a result of some of the disruption that's happening in Medicare Advantage, and that folks shouldn't be writing that market off just yet. Those are a couple of things to tease. There's more in the pipeline as well, but eager to engage with sponsors and companies that are in those spaces or digging into those spaces and just keep the dialogue open.
Well, thanks again for joining me, Rebecca. This has been a ton of fun. We've been friends for a long time and excited to see you in your new role. We'll have to do this again sometime.
Yeah, thanks, Geoff. This is fun.
Thank you for joining us on this installment of the Corner Series. To learn more about today's discussion, please email host Geoff Cockrell at gcockrell@McGuireWoods.com. We look forward to hearing from you. This series was recorded and is being made available by McGuireWoods for informational purposes only. By accessing this series, you acknowledge that McGuireWoods makes no warranty, guarantee, or representation as to the accuracy or sufficiency of the information featured in this installment. The views, information, or opinions expressed are solely those of the individuals involved and do not necessarily reflect those of McGuireWoods. This series should not be used as a substitute for competent legal advice from a licensed professional attorney in your state and should not be construed as an offer to make or consider any investment or course of action.